Okay, and I'm here now with a lovely Shelly Dockery from Little Rock, Arkansas. And Shelly is 26 years old. She's a two-time cancer survivor who does not have health insurance. Shelly, can you tell us, what you do and why you're here?
Currently, I'm a student pursuing my master's degree in graphic design, and the healthcare system just kind of drops you at the age of 25, but and hadn't been able to pick up on my own insurance. So it's a great opportunity to come out here and see about some opportunities that might be available. And even if I don't have insurance, like you mentioned, I'm a two-time cancer survivor, and so I really can't go without seeing my doctor because I've already had a reoccurrence before and had surgery on my eyes like when I was about 3 months old. So I do glasses and prescriptions and all of that, so I still have to continuously go and see him and just kind of make the sacrifices where I can.
And so how do you pay for these expensive medical visits?
Luckily, I still have parents that help me out, so they make sacrifices for themselves so that I can have.
And but as an uninsured two-time cancer survivor, what is it like to live knowing that you don't have insurance and God forbid you might
have an accident? You just take precautions every day. It's a struggle. You drive a little bit more carefully. You don't do things that other people might do if they have like ski trips or anything like that. That's just because you have to be extra precautious. So try to eat right.
And how do you get your cancer screen, your routine cancer screenings?
I still go in for my yearly checkups, and like I said, we just kind of, my family comes together and we just kind of have to pay for it wherever we can.
And what if you had to have an expensive test like a CAT scan or an MRI? What would happen? Those tests cost thousands of dollars.
Probably would be plumb out of luck. I've already was hit with a $20,000. My family was hit with a $20,000 medical bill from my second cancer that I thought my health insurance actually covered when I was covered, but from my previous cancer, they didn't even cover that. So we were stuck with a $20,000 bill, and I didn't find that out until maybe about a month ago, and that was about 10 years ago. So,
and what has happened to the bill? Has it been paid or?
Over years. That was like about 10 years ago, so it took years to pay for, but finally it's gotten paid for.
It took years to pay for the
years.
And do you think healthcare, you should be able to get healthcare based on your ability to pay? That doesn't make
No, not at all. It's a need basis, not an income basis.
Right, and the United States Senate is voting tonight on the first stage. What would you want to say to these 100 senators about the need for health care in the United States?
You see people out here, and it's a need thing. So I just hope that they take heed to the people that are in need out here and absolutely need it and really don't need to go without it, regardless of what their situation. So I just take it. Hope that they just take that to heart and make the right decision tonight so we can kind of end this whole process that we're going through right now.
Thank you.
You're welcome.